everybody. You've been following me. Thank you. Good morning. How are you doing wherever you are? I say thank you for subscribing, for the comments and the rest. All right, we'll be talking about certain things that have been delaying our ovulation, that has been delaying our conceptions. Today we're talking about it. So most of the things that causes those delays in our ovulation and conception, one is our lifestyle factors. When we talk about lifestyle factor, we have to talk about consuming a lot of food rich in sugar. So high intake of food rich in sugars can actually cause a lot of things. Even foods rich in unhealthy fat can actually delay our ovulation. So stepping down a little bit is the essential nutrients that we need. Essential nutrients that we need include the folic acid, it includes your iron and omega-3 fatty acid, are the things that helps us to get our ovulations intact. So now, once there is low intake of it in our diet or in our drug intake, it can actually affect our ovulation every month. So now, lack of exercises, exercises helps a lot in increasing the blood circulation in the uterus. Do you get increase the blood circulation in every part of our system, the respiratory, the reproductive organs, So the reproductive organs, it affects it so much. So now, as we're having those challenges, just know that engaging in intensive exercises such as marathon running and other jumping and the rest of it can actually increase your ovulation. Exercise, just like I sent the last video, I sent that exercise that will actually increase the movement in your pelvic bone, can actually in your pelvic regions, can actually increase the circulation of blood at that regions and that area, and then increase your blood flow, and then intensively help the ovulations to come at when due. All right, as we're talking about those things that equally affect us again is smoking habits. Smoking of those substances, smoking of cigarette, tobaccos and the rest of it can actually affect us so much. Do you understand? It can actually affect us and delay our ovulation. All right, so we're talking about smoking. We'll actually step down on consuming a lot of excessive recreational drugs. Do you understand? Substances, it can actually affect us, like cocaine, like heroin. Do you understand? So those like loud, a lot of things, even the prescribed ones. Do you understand? So a lot of it can actually delay our ovulation. These are the things we need to step out from. It delays our ovulation so much. It can actually cease the ovulation for that month and then result us to polycystic ovarian syndrome. So you have to be careful. These are lifestyle that we're doing. Most of the women smoke. Even their neighbors or friends don't even know they smoke. Even their husband might not actually know at a particular time that they smoke. These are habits that women keep that actually affect their ovulation. All right, we talk about anxiety. As we're talking about anxiety, it has a lot to do with our ovulation. Okay, it has a lot to do with our ovulation. When we talk about stress and anxiety, it has a lot. Experiencing chronic stress in our system can delay our ovulation. Honestly, I'm talking to matured ladies now, and I know that you are actually attributing this to some of the delays you've had, so much delays you've had in several months, and you're seeing that actually this is actually keying into what I'm saying. All right, so again, so engaging in all those stress, engaging in stress-inducing activities can actually reduce our ovulation, can actually delay the ovulation proper. Do you understand? So you have to be careful in engaging on anything that introduces stress to your system. It can actually reduce your conception ability. It can reduce the blood flow in the pelvic region, your uterus and the rest of it, the fallopian tubes, and then there will be a delay in the ovulation. All right, so poor sleep habits. When we're talking about this poor sleep habit, it has a lot. Inadequate sleep in our system has a lot to do with delay ovulation. 7 to 8 hours per night is what is so essential for somebody to have. You can actually put up your timer, you can actually help yourself, you can actually force, this is a mindset thing, you can actually force yourself to make sure you have enough bed rest. You're not doing that for any other person, you're doing that for yourself and your spouse. Do you understand? You're trying to make your family work for yourself. It's only you that can do it yourself. All right, as you are engaging in this, I believe we are getting something. Having irregular sleep patterns or working night shifts can actually affect our ovulation. You know, some people abroad who do night shifts a lot, it can actually affect you. For those people who actually who do night shifts at night, it can actually affect your ovulation. So you know how to put it up to make sure that you're having at least 8 hours sleep, possibly 9 to 10 hours sleep during the days, so that the night sleep will not be altered too, will not be a problem for you. Just make sure at the period you're having this, if it's possible for you to switch with someone else to get that month of your conception, at least 3 consecutive months, so that you'll be able to have a proper ovulation and conception will be addressed. All right, as you're doing that, being overweight or underweight can actually be another issue that can delay your ovulation and delay conception. How do I mean? When you have heavy body mass, do you understand? That alone is an outstanding one. It's not normal range. It's not actually something that you can actually boast of. When you have that, even your body system, even the uterus and the part of it, every reproductive organs down there will not allow the penetration of the sperm cells to be so free, so that conception, those sperm cells will get to go through the fallopian tube and get to the ovaries. Do you understand? Ability to be able to go down. Again, when you are underweight, it can actually affect you. What do I mean? Those women who are underweight, those women who think that they've watched weight to a particular extent, it can actually cause delay in ovulation. How do I mean? As you're burning your weight, if you're not careful, not eating properly, not actually attending to your nutrients, it can actually affect you. See those dietary meals, your fiber-rich food, those of your fruits are so essential when it comes to you taking care of your weight. Do not actually burn everything out without having an intake of supplying the essential things you need for yourself. Do you understand? All right, so I'm trying to say that the underweight women have to watch it, because your essential nutrients are equally going down. All right, as we're talking about that as well, we're actually talking about those people who have a body weight. When they measure their body weight, they're about, you see a woman of 20, a woman of 25, a woman of 30, 35, 40, is still giving you a weight of 45, a weight of 50. Do you understand? A weight of 30 something. Do you understand? It's unbelievable, but it's real. You know, so you see women going down. You see a woman of about 45 years weighing 52, 53. Do you understand? Underweight affects our ovulation. That's what I'm trying to bring to the table. Okay, another way our ovulation can be delayed is through certain medication. Taking certain medications, so certain medications can actually affect our ovulation. Yes, it can actually affect our ovulation. Those medications are anti-depression medication, can actually affect us. Blood pressure. Knowing that blood pressure affects not only the man, it affects not only the men, it affects women as well. It delays your ovulation. So be careful and make sure you don't fall into that BP state, because the BP drugs will delay your ovulation and affect you so much. Not discussing these medications with your health provider will delay your ovulation and then affect you. Exposure to toxins. Women are so much exposed to toxins. Some are the ones we inhale when we are, or those what's it called, when we're trying to kill our mosquitoes and the rest of it. It delays our ovulation when you inhale those toxins. Okay, travel and work schedules also can delay your ovulation, because it can actually put up stress at a particular time. So you have to be careful. Age can actually delay your ovulation. Age between 35 can actually delay ovulation. So certain lifestyles, so you have to be careful. It declines once you're 35 and above. It declines, your age declines your ovulation. So get your fertility declines at that point. So be careful as you go on. Thank you for subscribing, and remember,